Here at ASH 2015, I'm Thomas Baldrick, joined now by Dr. Jan Beyer-Westendorf from Dresden. Thank you, sir. I know it's been a busy conference. Thanks for coming by. So you got a couple posters. Let's talk about one of them, and Noacs in pregnancy.
Yes.
So let's get into some of the issues. If a young female patient gets anticoagulated, is pregnancy a problem for her?
Yes, it is. For two reasons. First reason is the reason why the patient is being anticoagulated. Most of the young female patients getting anticoagulated because they have either a heart condition or they have a venous thromboembolism. Both of them put them at a high risk of pregnancy complications. The second reason why pregnancy in anticoagulated women is a problem is the fact that some anticoagulants actually may cause harm to the fetus. So this is something that has to be considered, both the health of the mother, but also the well-being of the fetus.
What types of anticoagulation can be used in women who are pregnant?
The standard nowadays is clearly low-molecular weight heparins, which can be used over the whole period of pregnancy with an acceptable side effect profile and a high effectiveness to prevent coagulation problems like thromboembolism. Some patients with mechanical half-valves need to be treated with vitamin K antagonists, but that's only a minority. So the vast majority of pregnant patients in need of anticoagulant therapy get treated with low-molecular weight heparin.
What is the significant issue for why Noacs cannot be used or should not be used in pregnancy?
Again, there are two reasons for that. The first reason is they are very small molecules which are known to cross the placenta, so they actually anticoagulate the fetus as well. And the second issue is that we actually don't know whether this is can cause a potential harm to the fetus by causing either bleeding or anatomical abnormalities. So we don't know that yet.
What do you know about a protocol in case a woman who is pregnant gets accidental exposure?
This is exactly what my poster was about. So I had experience that some obstetricians and gynecologists recommend elective abortion for female patients who got accidentally pregnant or unplanned pregnant while taking a Noac. So that got me thinking whether it's really it's a valid approach to recommend elective abortion to those patients. So I wondered what data are there that give us an indication whether there is a medical issue. So we collected from a number of sources. We collected more than 200 or more than 300 reports actually of patients being exposed to a Noac in pregnancy. And when we got rid of duplicates, obviously some patients will be in more than one database. When we got rid of the duplicates, we ended up with 230 patients that we had well documented the type of Noac they received, the duration of Noac exposure in pregnancy, and so on. And out of those, we had outcome data on 130